So we're also going to share a case through our journey. We're currently using a large number of the Sapphire Connects and really using those exclusively, almost exclusively for our TPN patient populations. So we're going to kind of walk through a TPN patient that probably may not look much different than many of the TPN patients you have, but we're going to kind of walk through that journey and kind of tell how we've used this technology to really improve the care that we're able to provide this patient. So we had an approximately 7-month-old patient that was started on service with us in May of 2023. Unfortunately, at the time, we didn't have this technology available, but the patient kind of during the summer of 2023 was readmitted 2 or 3 times to the hospital, continued to lose weight throughout that period of time, really because there was a strong degree of suspected non-compliance. We always had, some inventory issues here and there. One bag, would have an extra bag here or there, but couldn't really pinpoint it too well. So in September of 2023, we then, as we began this pilot, we identified this as a patient that would be a great opportunity to leverage the technology and transition them to one of these connected smart pumps. So you can see here, we're kind of showing you their September administration data. So each bar, it's a 30-day time period. If you look at it, so each of the blue bars would be a day that they administered. But as you can see, there's a lot of gaps in there. And so that's ultimately what we were seeing. And we were able to really finally validate this information in terms of compliance and share that with the care team so that they had a true understanding of what percentage of the TPN the patient was receiving. Unfortunately, in this case, because we worked with the team, the patient was admitted via social services in October to make an intervention because of the continued failure to thrive, as well as, unfortunately, the patient was really just not developing appropriately. Fortunately, or unfortunately, in late October, when the patient redischarged, there were some caregiver changes, and so custody was shifted due to that social service admission. And so after that discharge, kind of based off of that intervention, you can see here what kind of happened. So that beginning of October, the patient was in the hospital, and essentially immediately after discharge, you see a significant change in the overall compliance. We're happy to report that kind of since we've been able to have this technology, actually this patient's doing very well. And now we're actually being able to titrate the patient's nutrition needs down as they're kind of meeting all their other aspects from their therapy.